Today we will see about the respiratory system of the human body. So the air which we are taking inside of our body is mechanized by the respiratory system. So this respiratory system is divided into two parts. One is upper respiratory system and another one is lower respiratory system. So here in the image you can see clearly upper and lower respiratory tracts. So these two tracts consist of some organs. So we will see about that. One is nasal cavity, pharynx, larynx, and lower respiratory tract consists of trachea, bronchus and lungs. We will see about each and everything, where it is located and its function. So here first we will see about the nose. Here is the nose. So this nose is made up of cartilage outside of the face, and inside nose there is some mucous membrane. So it helps in taking off outside of the oxygen into the human body with the help of this nose only, and this air will enters next into the pharynx. So here is the pharynx, you can see, and this is divided into three parts. Here you can see nasopharynx, oropharynx and laryngopharynx. And one more thing, this is also called as throat. So what does this pharynx will do? So it connects like a channel and it helps in moving of the air from nose into the trachea, that is to the lower respiratory tract of the respiratory system. Next is about the larynx. It is also called as voice box. So the name itself is indicating that it creates some voice. So whenever the air is entering into the body, it creates some voice sounds and it contains vocal cords. So this is about the upper respiratory system. Next we will see about the lower respiratory system. As we have seen here, see, this is the trachea, right? This is the trachea, this one, this long one, this is 12 centimeters and it is surrounded by the cartilaged C-shaped ring. So this is about the trachea and it is also known as windpipe, and again this trachea is divided into two branches, that is right and left pulmonary bronchi. So after the air enters into the trachea, then it again enters into the bronchus. So here you can see the bronchus. So this one, this right and left, and this the righter one is wider than the left one. So again after the bronchus, it is divided into bronchi, secondary bronchi, and again this bronchi is divided into tertiary bronchi and bronchioles. So like this air enters from upper to lower. Next we will see about the lungs, the major part of the respiratory system. So this is situated in the thoracic cavity of the body and it divided into two lobes. As you can see clearly in the image here, it is divided into two lobes, right lobe and left lobe. Okay, so again these are divided into some segments. So left one contains 8 segments and right one contains 10 segments, and as this has lobes, so left lung has 2 lobes and right one has 3 lobes. So again I'll explain about alveoli, the main mechanism of the respiratory system. So this is the trachea and bronchi, right? So finally it enters into the alveoli where the exchange of the carbon dioxide and oxygen does. So with the help of that only we are taking the purified oxygen. Okay, so I'll explain clearly about the mechanism of this one. So as the air enters here, so this alveoli is there, right? So this one is the alveoli. So the alveoli consist of it inside of the walls of the alveoli it consists of some blood vessels. So we'll call that blood vessels as capillaries. So what does this capillaries will do? It helps in exchange of the carbon dioxide and oxygen. So with the help of the pulmonary artery and pulmonary vein. So this pulmonary artery is there, right? So it takes the blood with the help of the capillaries and it enters with the help of this artery only, and the unwanted purified, that is which is not purified, is taken away by the pulmonary vein, and in this alveoli only the carbon dioxide and oxygen mechanism, that is exchange, will happen. So this is the main part of the respiratory system. So we'll see about the medical terminology of the respiratory system. Some medical terminologies. So alveoli, it's nothing but air sac. Broncho means bronchial tube. Pulmo, lung. So for lung we'll call in medical terminology as pulmono. Pleuro. So for nose we'll call it as naso. These are some prefixes which are used in the medical coding job for in order to understand about the medical coding. Next we will see about the pathology of the respiratory system. This is the pathology of the respiratory system. So whenever any disorder or diseases occurs to the respiratory system, it leads to some conditions. So these are the conditions. One is pharyngitis. So it is nothing but we have seen the pharynx, right? So when this pharynx gets swelled, that is inflammation. So when it gets inflamed, it leads to condition called pharyngitis. So similarly like that only laryngitis. So whenever the larynx gets swelled or inflamed, it leads to laryngitis. Next is COPD. It's nothing but chronic obstructive pulmonary disease. This is very severe condition. Next is asthma. So whenever the airways get narrowed, so it leads to the condition called asthma, and the symptoms are like breathlessness, wheezing. So these are some symptoms of the asthma. Next is bronchitis. It's nothing but similarly like pharyngitis and laryngitis only, it's the swelling of the bronchus. Next is emphysema. It is accumulation of pus present in the pleural cavity, that is in the lung. So whenever the pus formation is there, so the person is unable to breathe inside or outside, so it leads to a condition called emphysema. So this is about the respiratory system.